Good afternoon, and welcome to this week's Small Business Town Hall. I'm so glad you're joining us. Today's conversation is going to include updates from partners from the SBA, the Department of Labor and Training, and also the Rhode Island Small Business Coalition. And from the Rhode Island Department of Health, we have very important information from the Department of Health. So I'm so glad you joined for this conversation. Then we will hear from three of our state's largest entertainment venues who have made a very important decision for their safely reopening now during this pandemic. And we're going to hear from Josh Shore. He's the founder and artistic director from the Wilbury Group. So used to saying Wilbury Theater. Lynn Singleton is the president of the Providence Performance Arts Center, better known as PPAC. And Lisa Utman is the executive director of the United Theater in Westerly. So we're going to hear from them later on. But before, I just want to begin giving some update to our viewers. Important information. So we want to remind all of you that are dealing with the challenge of maybe losing your apartment. The United States Supreme Court overturned the CDC's rent moratorium. So I know there's a lot of individuals out there who need assistance paying rent. Please remember that there is help available. Make sure that you go to the Rhode Island Housing website, or you go to the rentreliefri.org, and you can find support in there. They can give you assistance to pay the rent if you owe rent. They can give you assistance to pay for an apartment if you're going to be renting an apartment. And also they can help you to pay your utility bills also. So make sure you go to rentreliefri.org and get assistance right there. If you're having any issues reaching out to them, please contact my office, Billy Kepner, who's connected here with us, and Ben is going to be sharing his Billy Kepner email right there. Make sure you send us an email, we can make the connection for you. Second, please remember the Delta variant is very, very contagious. So you're going to hear more from the Department of Health in a little bit, but the vaccine, the Pfizer vaccine, it has been already fully FDA approved. So if you were waiting for the approval in order to get the vaccine, please do so. Do it for yourself, do it for your loved one, people around you that you can protect if you are vaccinated. So if you want to set up a vaccine clinic in which we can go there, if you have, let's say, 25, 50, 100 employees in one location, and you would like for the state to set up a clinic, please also contact my office, send an email to Billy, and we make sure to put you in contact with the health department and the National Guard to make sure that we can have a clinic right in your venue. Now, we're going to go to the discussions with our distinguished panel. We're going to start with Mark Hayward, Director Hayward from this SBA here in Rhode Island. Is going to give us information about what is the latest news with the SBA. Director?
Hello, Governor. It's great to be with you again today. And it's really appropriate because we had a press release that came out came out August the 27th about SBA will open up supplemental grant applications for shuttered venue operator grant awardees. So that means that those individuals who did receive a shuttered venue operating grant, we call it SAVOG in the federal language. We got to have an acronym for everything.
For everything.
So, sorry about that one. But basically what it does is it provides additional resources to those who already got grants. There was money that was left over. I have had first of all, I've known Lynn Singleton probably longer than I want to admit to. And he and I and his staff, we've chatted a number of times. So, the agency will be sending out to those individuals who did receive an award additional information in the coming days. And so that's really, it's very appropriate that you're having those individuals on today, Governor. So that's excellent. On the issue of PPP forgiveness, I can tell you that that's progressing quite quickly. There are a number of people who have been forgiven or totally forgiven. We do know that there are some discrepancies where the lenders have said, no, you're not going to get total forgiveness. The interesting thing about that is there will be a process for people to appeal. So that appellate process, if you think that they were wrong and you were right, there will be an issue where you can bring that appeal to the SBA. Because remember, we don't make the SBA doesn't, we make the final decision, but the recommendations on the decisions, whether or not you're granted full forgiveness, is done by the lender first. It's very unusual, Governor, for the lender not to. The instances that I've seen is when individuals who have applied for 1099 people who work for them has become a conflict. And the only reason why that is, Governor, is because people who are 1099s were able to get it on their own. So it's really difficult to determine, did they get it on their own and did they get it through their employer or the people who are. So that was one issue. The Economic Injury Disaster Loan Program continues. The EIDL Advance, which is a grant, is still available for those individuals who want to seek that, who want to apply for it. It's an additional $5,000. And I know that there are a number of people out there, Governor, that actually have expressed that interest. We're trying to get them in the right place. Now, having said that, not everything is, roses, as they say. Yes. We know that there are issues with those who are applying to get increases on their current economic injury disaster loans. We know that the 4506C NT, which is the IRS verification of the tax return, has become an issue because we're getting hundreds of calls. We're trying to deal with those calls and go back into the system and see exactly what the issues are. It's really important to file the taxes, and a lot of people have they've deferred filing their taxes for 2020 or 2021. That's making it a little bit more difficult for the agency to do the verifications, Governor. But I can't tell people what to do. I can just make recommendations because the agency is actually looking at, now we've increased to 500,000. The agency is now doing a comprehensive review as to whether or not we should go back up to the $2 million mark. Decisions, I do know that they have sent requests to the White House. So I do know that there are going to be decisions coming down within the next 10 days. So which may, I didn't say will, which may make available additional resources through the EIDL program. But filing of taxes, getting the 4506T verifications is what the agency has to do. So, not everything is perfect, Governor, but we're moving it along. And Ben has put up the email address. If you are having issues, please send us an email so that we can follow up on it. It's not perfect. I've missed a few people today trying to call them back. We know that there are issues. We are trying to resolve it. And please, I would say to the small business community out there, I have exactly 7 people that work for me. I have the agency has taken 1 person to work on the Navigator grants. So that makes 6. The agency has taken 2 people to work on the shuttered venue operating grants. So that now we're down to 4. And of those 4, only 2 of them are considered to be, professionals or management. So we're down to 2 people, and I'm one of them. So I can only do so much. And we appreciate everything that you do. Don't hesitate to give us the info. We're happy to do that, but you have to understand we have constraints as well.
No, thank you. Thank you for everything that you're doing. And as you heard right now, he's calling back. So make sure you're paying attention to your phone because he's calling back right now. So thank you for the update.
Thank you, Governor.
Have any questions, Ben?
No questions for Director Hayward today.
Thank you very much. Good to see you, Ben.
Thank you, Director. Thank you for your time. Bye-bye. Thank you. Now, I just would like to hear from Director Matt Weldon from the Department of Labor and Training. Hi, Director. So good to see you again. It was so good to see you this morning during the Small Business Advocacy Council meeting. So thank you for joining us again here.
Happy to, and I'm looking forward to working with that group going forward. You know, a big part of how we succeed in government is by being responsive to people and having good, clear communication. You know, the program that you host every week has been a big, I think, a big help for a lot of people. And when we did it with Governor McKee, it was great. And I'm going old school today. I'm back in my old office. So everybody saw me with this background for a long time. I keep kicking my colleague out of the office I gave her because they're doing construction outside of mine. And all you would hear is them, you know, banging and
banging.
things. So here I am. Okay, so unemployment. We've been talking for a long time about all the federal programs that came up during the pandemic. They've been great. They were a lifeline for so many working families in Rhode Island. At one time, we were paying over 125,000 people a week. That's unbelievable. Mm-hmm. Now, the programs are coming to an end. That's the pandemic unemployment program for gig workers, self-employed folks, business owners that wouldn't typically pay into unemployment for themselves. You know, they're covered under these programs. The extra 300, huge. That extra 300 used to be 600. And, you know, we talked about that. It became 300. It's been around for a long time, the better part of 17 months. And just from that extra amount alone, which I argue was always intended to be a stimulus payment to go into the economy, but it was pushed through unemployment because we had a relationship with folks and we could do that. Just in that program, we've paid $1.85 billion with a B into Rhode Island's economy, which is being spent at small businesses. So it's a big deal. I'm very happy that we held on to it as long as we could, but that too is coming to an end. And the last program was just a series of extensions for unemployment because typically it only lasts up to 26 weeks. We've been able to continue those claims for a long time. You know, we worked together to do a couple of things. One thing was to reinstate the work search requirement, meaning everybody had to start looking for work again. You know, the vaccination percentage was high. We were in a very good place. On May 23rd, we required people to start looking for work. Since then, 12,000 fewer people are collecting unemployment. And we know more have gone off, but because of seasonal claims that come on every year, new people come in. And so that's always going to change the number a little bit. We also know that those changes that we made together with the legislature to allow people to work and earn more money and keep some of that money has impacted 11,000 people. 3,600 people have been able to get a payment they never would have gotten before. Almost 11,000 have held on to more of their earnings, maximizing their family income, which has been one of our top priorities. Very good things have happened. But the bad news is the program's come to an end and 45,000 people are going to fall off of unemployment in a week. Now, how can we help them? We tell them to go to backtoworkri.com, backtoworkri.com. That's the virtual platform that we set up during the pandemic to provide service to people. What can we do? We can connect with people with job opportunities that are open immediately, training opportunities, career coaching. They can use an assessment tool that will, take a look at their experience, their interests, and tell them what fields they may want to go into and if those are in-demand occupations. And we also serve employers for free on that website. Sign up to host a virtual job fair. We can post your jobs. We can find your talent. There's a lot of things that we can do. I know it's a lot of information in a short period of time. The last thing, Workshare. Workshare has been a great program. For a long time, Workshare has been highlighted. Rhode Island's program is one of the best in the country. We're going to continue to modify the Workshare program to make it easier to use and more accessible. We've helped hundreds of companies during the pandemic. Workshare will continue, but the funding for Workshare will now go back to how it's always been funded, which is just by employers, the same way they'd fund any other unemployment claim. So Workshare is still available. Please reach out if you'd like us to help you with that. I can see that Ben put the info up. Any questions for DLT, 415-6772, or go to DLT's website and you can find all the information that you need.
Thank you, Director. For our next Facebook Live, we should talk about Workshare. So what the changes between the federal and the state round. So I think that's going to be very helpful to help the small business understand the changes. So let's just concentrate on that for the next one. Thank you. Ben, do you have any questions for Director Weldon?
No questions for Director Weldon. Matt, it's nice to see you back in the old office, but I think that the new one suits you more.
All right, thank you.
I agree. Thank you, Director. Thanks. So next, we're going to hear from Chris Parisi. Chris is the founder of the Rhode Island Small Business Coalition, and want to hear what is happening with the Small Business Coalition, Chris. How are you
Hello,
doing?
Lieutenant Governor. How are you?
Good. So good to see you.
How was the council meeting this morning?
It was really good. We have some really good feedback in there, and looking forward to re-engaging everyone in that conversation. I hope to see you there also next time.
Yes. I was a little confused, but we'll talk offline there. And what you're doing and is great. Giving small businesses an opportunity to speak directly with yourself and other elected officials, being part of the system. That's what we need to do to create the change that we need. Director Weldon, Director Hayward, they're always on these calls providing some great information about these grants, about unemployment. Really have to give a shout out to backtoworkri.com again, especially when you have thousands and thousands of folks that are going to be coming off this federal unemployment. That is an economic issue for more than those that are just unemployed. It is a small business issue as well, as he outlined, with over $1 billion, going into the economy that, won't be there anymore. So make sure we all get back to work and, continue to get that income so that we can support our families as well as our small businesses. But Lieutenant Governor, on behalf of the Rhode Island Small Business Coalition, a few updates that we have. One is that we're building a new portal, which is really exciting. So
Awesome.
yeah, we're, stay tuned. It's only in the beginning works of the scope of work, but we're going to build a portal that will better connect businesses with each other, with government services, and with other great organizations so that collectively we can have one centralized hub to, really elevate our small business community. And we also have the live forum every other Tuesday at 12 p.m. Obviously, this program is the other one every other Tuesday at 12 p.m. I believe we have Senator Reed next week. Maybe Ben could even correct me if I'm wrong, but I believe we have Senator Reed next week. So if you have any questions, please email us at info@rismall. Oh, Senator Reed isn't important. Maybe it's Senator Whitehouse. But email us at info@rismallbusiness.org or follow us on Facebook. And lastly, one thing that the topic of this conversation, we're going to have some great panelists coming up next talking about the vaccine mandate, right? So Governor McKee and yourself has urged businesses to impose the vaccine mandate. And with the coalition, we actually have a diverse set of opinions, believe it or not, where some are absolutely for it and they employed it. We have some yoga studios that employed it and other businesses to promote the safety and wellness of their customers. And we have some on the other side that would not even think about imposing the mandate. So what does the coalition stand? Well, number one, we will urge all Rhode Islanders to get their vaccine. We're already top 5, 6 in the whole country, and it helps our small businesses because the better we can tackle this virus, the better it is going to be for our economy. But secondly, we always say, let the businesses make their own decisions. So we appreciate the governor's stance of urging businesses to make their own decisions. Whether they choose to or not to is in their own best interest. So we love that the businesses were able to make their own decisions. And we have some great stories of those that are imposing the vaccine mandate or negative test to promote health in this great state of Rhode Island. And I know you have some coming up soon, so I'll leave it as that as a tease.
Yeah, so, no, thank you. Thank you so much, Chris. And I just want to remind everyone, right now, the position that the governor has is we encourage every business to have vaccine and mask protocols in there. You can have your own protocols as of right now. That's the position that we have at this moment. But we encourage as many businesses as possible to have their own protocols for how when it comes to mask and vaccine. But of course, we are listening to the science and I personally always have my mask whenever I go to a place that I'm going to be with individuals that I don't live with. I tend to use my mask often. And so I want to encourage all of you to have your own protocols. And we're going to be hearing more about that. So next, we're going to go with the Department of Health first. They're going to show some data that is very important for the business community when you're making a decision about the mask and vaccine protocols. So next we have with us Shima Dixit, the Director of the Division of Environmental Health from the Department of Health. Shima, welcome.
Thank you, Governor, very much for the opportunity. Good afternoon, everyone, and thank you for your time in advance. I'm going to ask for the slides at the end because I do have a couple of data slides just to give you a snapshot of how things are looking like epidemiologically. And I'll be happy to share more via slides as well. So thanks, everyone. As you know, it's been a long, long road for all of you, particularly for our businesses, as our world came to a standstill last March. And then we tried to reopen through phases. We all together jointly opened phase 1, phase 2, phase 3. Then we went through the pause. Then we again started loosening some restrictions. And finally, we are where we are with our state being fully open for economy as of May 28th. So it's been a long journey. The pandemic is not done yet, as all of you must be reading in the papers, in the news. The Delta variant is way more stronger than what we have experienced in the past 12 to 15 months, and its level of transmissibility is very, very high. So to that effect, we are closely monitoring the data. We are trying to promote vaccinations as much as we can to keep Rhode Islanders safe. We have a tremendous burden currently on our hospitals. We are opening up our alternative care site. You may have seen in the news the director and governor is recommending to only seek emergency care in emergency rooms only for emergency reasons, which also is a good reminder that we need to reduce the load on our hospitals, on our emergency rooms. And to that effect, and to keep everybody safe, and to continue promoting our economy and never to take a step back because we are moving in the forward direction, the Department of Health, along with business, along with commerce, is recommending a few strategies. And I think it's very well known. Centers for Disease Control and Prevention is recommending the same strategies for businesses. And they include A, is to consider requiring vaccination, full vaccination status record for their patrons and their employees. Thank you very much for sharing the slides. Number one is to require and check for vaccination status of your employees as well as your patrons. Number two is cyclical testing. We have realized that when there is cyclical testing happening and staff and employees are regularly tested, as soon as there is a positive individual or there's a positive test, we remove them, we isolate them, we stop the mitigation, we stop the transmission right there, and it has been a very effective mitigation tool right from the beginning. The third thing we are recommending is requiring indoor masking for patrons as well as for all employees. We have data that has shown that about 70 to 80% of transmission can be controlled and can be prevented if there is indoor masking. So I'm very happy to hear, Governor, when you said, I always wear my mask when I am in a place with somebody I don't live with. That is our communication strategy we have tried to promote for more than a year now. If you are with somebody you don't live with, wear a mask. And now we are recommending that businesses require indoor masking. Lastly, the way we were able to open our schools last year, if you remember, was because we did a walkthrough of all the schools in Rhode Island and we helped them with their ventilation status. So the more number of air exchanges, we recommend 2 to 4. Sometimes it's more, some places. If they are less than 2 to 4, we are more than happy to give recommendations in terms of what could be done to improve. Is there a window that can be opened? Is there a HEPA filter? How can ventilation be improved? Because the better the ventilation, the lower is the transmission. So I repeat, there are 4 things that the Department of Health is following in terms of Centers for Disease Control and Prevention guidelines, and is encouraging businesses to follow this 4-prong approach, which is requiring vaccination status for your employees and your patrons coming in, to do cyclical testing of your employees, to require indoor masking, and lastly, to ensure there is enough ventilation in your venue. I also have a number that is set up, a phone number where businesses can call if they need any support and assistance towards this resiliency against the Delta virus, which is 401-889-5550. We want to develop these tools in collaboration with you. And as the governor said before, we are encouraging all the businesses to have their own protocols. These are the 4 best recommended strategies we are recommending for all businesses. Maybe right now your business is in a position to do 3 out of the 4, and that's okay. But each one of them will help reduce the transmission, will encourage patrons to come to your business, and will keep everybody safe, because we really want our businesses to thrive. We've come a long, long way from our lockdown and quarantine. We opened up way early. We are doing very well with vaccinations in the country, and we really want to keep moving forward. As schools are opening, as things are happening in terms of fall with more people being indoors, we believe these mitigation strategies will really help patrons feel safe, because there will be reduced transmission, there won't be outbreaks, and your businesses will continue to see what it saw in summer when we opened up fully. And I'll stop there. I have my colleague, Amir, Dr. Amir, who is going to share a couple of slides related to our epidemiological trends that we are seeing, as well as what we are thinking about will happen in the 5 to 11-year-olds when schools open, with some mitigation in place and more mitigation in place. Because as all of you know, the 5 to 11-year-olds who are back in school this week do not have a vaccine yet, and it's yet to be approved by FDA. So on to Amir, and then I can take questions.
Yeah.
Thank you, Governor.
Thank you, Dr. Amir. And I'm one of those. I have my daughter, is 11, just turned 11, so I have to wait almost a whole year before she can get the vaccine if it doesn't get approved. So I'm all ears. Tell me.
Sure. And thanks for having us. Hi, everyone. Thanks for all you do. I know it's been a really tough 15, 16 months. Then if you go to slide 5 that you were just showing, I'd like to just set up the stage on where we are standing right now in terms of the data, and what are we seeing in terms of number of cases, hospitalization, and unfortunately death happening across the state, to kind of orient us on what we are seeing. And as we have seen through the last 12, 13 months, governor's press conferences, a variety of different outlets that we have had, we present always with data, and we lead with data to understand where we are standing. You've seen a surge recently happening because of Delta variant, as Seema mentioned, and we are tracking on what's going on. The good news is we are flattening at this point in terms of the cases, daily cases happening. We're seeing 200-ish cases per 100,000 people. Because of the FDA recent approval, full approval, and also the Delta variant, jumping up, we are seeing on the lower right side, we are seeing a bump on vaccination happening. And I would like to connect points and mitigation points that Seema was mentioning to the elements that you're seeing at the bottom of the screen here. Those 3 areas on continuous testing, continuous screening, as well as certain mitigations that we can put in place along with vaccination, that is helping to flatten the curve and hopefully come back down to the level that we were in back in May and June. Then if you go to the next slide, what's happening with schools and students especially. This is really important for us to model and predict what is going to happen in the next 2 months or so. What we are seeing here is we are looking into modeling and predicting number of cases in this specific case for young children aged between 5 to 11. If there was no mitigation, if there was partial mitigation, and if there was a strong mitigation. The dots that you're seeing, the red dots, is where you see the very large peak that's going to happen end of September, early October, if there was no mitigation. This means that if there was no masking, this means that there was no social distancing, this means that there was no cyclical testing. And we all know that's not going to happen. So hopefully that's not going to be the case that we're going to experience. But the impact of mitigation, the yellow dots and the green dots, which is virtually non-existent on the green dots, is the importance of how the 4 points that Seema was mentioning can come to play and help us keep our, especially kids, children, students safe, and apply this to across the society. Cyclical testing, vaccination if you are eligible for vaccination, and of course masking. These are the elements that can help flatten the curve, go from yellow to green dots. And thank you for all you do. And this is something that we continuously share online on our Rido website. If you have any questions, you can reach out to Seema, myself. More than happy to help.
I have to unmute myself first. The first question that I have is the vaccine for the 5 to 11 years old. Any timeline about when can we see that?
So as far as we know and track with FDA and CDC, they're basically the clinical trial data are submitted and they're reviewing it. And it seems like by end of this year, we should see something for the younger children.
Thank you.
Sure.
Thanks. Seema, do you have any additional information? If not, we can check with Ben. Is there any question?
Governor, I just want to reiterate that we are very thankful to businesses. We were one of the most successful states with community mitigation, and I personally, leading that process for the state, feel very, very grateful that our businesses cooperated very much, and we hope our economy trend continues in terms of leveraging our community mitigation. Thank you.
Thank you so much. Thank you both for this important information. And again, a reminder, the health department is available if you want them to have a conversation with your business association, with any particular group of businesses, they are available. Or if you want to just reach out about your own business, contact them. Ben has posted the contact information right there. Make sure you reach out to them. They're very available to help you answer any question that you have. So thank you so much both. And right now we're gonna go actually to businesses that have reached out to the health department, and based on what the information they have gotten, they have established protocols on how they're going to reopen. These are business community that want to make sure that we don't go back. We like being able to attend events. In this weekend, I was able to go to 2 different festivals in the park. So we don't want to go back. And if we don't want to go back, we have to take steps to keep one another safe. So with that, I'm going to be bringing now, we're going to hear from Josh Shore from the Wilbury Theater, Lynn Singleton from the Providence Performing Arts Center, and Lisa Oudman-Randolph from the United Theater. Welcome. I'm so glad that the 3 of you are here with us today. Thank you so much.
Hi, Governor. Thanks for having me.
Good seeing you. Well, I just want to, I have a few questions for you in how we can share this information with the rest of the business community regarding the protocols that you have. Each of you have made a bold decision that requires a certain protocols for your guests. And I'm going to ask each one of you what made you make this decision to require proof of vaccine or a negative COVID test to enter your venue. And I'm going to start with Lisa. Lisa?
Hi, thank you, Lieutenant Governor. I think for all of us, it's probably multifold why we made the decision. One is we want to keep our staff and our patrons healthy, but there's an added aspect to it for those of us who present performing artists. And it's also about keeping those artists safe. You know, we all know that performing artists, musicians, people that work in theater and dance have been incredibly hard hit economically. Being able to perform in venues throughout the country is their livelihood. It's what they do. It's what they need to continue doing. And so a big part of the reason why we at the United wanted to make sure that we had protocols was to ensure their safety and to allow the artists to feel comfortable coming into our venue and have them know that we put their safety first. If anyone in their entourage, whether it's the performers themselves or the people that do all the behind the scenes, work for them, if any one of them ends up getting COVID, then their whole operation shuts down and all of those people are suddenly once again out of work.
Thank you. Thank you for that information. Josh, what can you tell us about your decision process?
I think Lisa captures it perfectly. After being shut down for so long, the theaters are, we're excited at the news of the vaccine and excited to get back to work and reopen and welcome our audiences back in. And I think making sure that everybody that comes through the door has proof of vaccination or a negative test within 72 hours. I mean, these are steps that we can do. It's a business decision, and it's also a way for us to encourage everyone in our community to get vaccinated so we can all get back to work.
Thank you. Lynn, how was the process for you to get to this point?
Well, PPAC and we also run vets. We simply mirrored the protocols, safety protocols that the Broadway theaters in New York put in place probably a month ago. I call it the MTV program: masking, testing, and vaccination.
Like that.
It's state government, and you guys like acronyms, I know.
We do.
And you know, we required, as of July 15th, all of our full-time, part-time, volunteers, police details, our event people, everybody to be fully vaccinated, because the Broadway shows that we book are equity shows, and they're requiring anybody they come in contact with in a building to be fully vaccinated and some other, oh, by the ways. So that certainly was a catalyst. The interesting thing, and I'd be curious from Josh and Lisa's perspective to know this, you ponder these decisions and, how are they going to react and what's it going to cost in ticket sales or how many people are going to ask for refunds and all that. So we did this, whatever day we did this, and I credit, he's not on this call, but I credit Tom Parrish from Trinity for providing that leadership, because he certainly was the first person to call me. But so we announced this, and I was expecting all these refunds from subscribers and single ticket purchasers, et cetera, et cetera. And of course, we have, like you all do, a social media page, and everybody on that social media page, we did due diligence. We never bought a ticket at PPAC. Sounded like my ex-wife, and wasn't very happy with me. But at the end of the day, dollars and cents wise, we refunded $15,000 worth of tickets. It's a rounding error. We have 14,000 Broadway subscribers. We refunded 30 Broadway subscriptions. I mean, it's a round. They just come sit in a seat for 2.5 hours with a mask on. That may explode, but that, I took that as a very much a positive. Actually, I was very pleasantly surprised. I don't know if Josh and Lisa have gotten the same reaction. I'm very pleased.
That's a good question. So, Josh and Lisa, what has been your experience there?
We did not receive any negative feedback. We got a lot of great emails and comments and people saying, "Way to go, great idea. So happy to see all these performing arts organizations working together to make this mandate happen." We got a lot of positive feedback, but we didn't get a single cancellation or a refund requested.
Excellent.
Okay, great. Lisa, what about?
Yeah, we've had similar. I'm actually just, Ben Barber just mentioned,
He bought 4 tickets already.
Yeah, so thanks, Ben, for buying tickets. Yeah, we've had primarily positive as well. I think I even had a couple of people who said, that they were not coming to an event here because they were nervous about it. And once we put out our policy, that, they felt much better about it. And I think that the only negative comment we had was one person who suggested that we were trying to give out health information, let the CDC and the Department of Health do that, they said, and that we should not be mandating that people, especially children, are vaccinated. And we were able to let them know we're not telling you what you should do. You're welcome to come with your mask on and show a negative PCR test or antigen test as well. So that was the only negative we got back. I think that a lot of people, the 2 top things that me and my friends and everyone else I talked to during the height of the pandemic talked about was dying to go out to a restaurant. I'm dying to go see live music or performing arts events. And I think so many people, and I'm sorry, there's construction going on behind me here. It's part of the deal. I think so many people are so well aware of how much they miss those enriching performing arts and cultural events when we were shut down. And so I think that people primarily feel like if that's what it takes, if I have to show my vaccination card, so be it. If I need to sit in a seat, with my mask on for 2 hours, that's fine. I want to hear the live music. I want to see the live performance. I want to experience that. I want to be around people and in community again. So I've been, same as with Josh and Lynn, we've had positive feedback from people.
Okay, great. So let me go back to Josh. Can you tell me what the patrons can expect when they walk through your venue for this coming season?
Sure. Well, what we're doing is we're trying to keep our programming as outdoors as much as possible. Where the vaccination requirement, where we're not enforcing that, we are encouraging people to wear masks. We won't be checking vaccine records. When people come for an indoor performance, though, we are exploring mobile apps where patrons will be able to upload their confidential vaccine records, and they'll put it there, and they'll just have to show us on their smartphone a QR code that we'll scan that will just tell us that this person has proof of vaccination, and they'll be allowed in. We are requiring all persons to wear masks at all times while seated, unless actively eating or drinking. We are debating whether or not we'll even have concessions open, or if we'll just keep it closed. Our performance space is much smaller than PPAC, for example. And the idea of having 50 or 60 people in there, even if they're taking their masks off just to have some wine or something, that's not something that we're sure we're comfortable with. So we'll have people masked up, and everybody that comes through the door will either show us that proof of vaccination, or they'll show us the negative test results from a PCR or an antigen test.
Lynn, what about PPAC?
Well, it's going to be an operational lift, but we're going to check vaccination cards, require masks, testing. If you don't have a vaccine card, I suspect, without any solid information and be anecdotal, I suspect with Lisa and Josh, our offices, I would guess 97% of them are vaccinated. At least I hope they are. But, we're going to do Styx and Elvis Costello and Cheap Trick this fall. So I bet that company, those aren't. So got to figure out how to provide testing. Thought I had is, I know the state has a mobile testing outfit that comes to places. And I actually got the name from the Civic Center. So I thought about for Pretty Woman, which will slam about 20,000 people into the city in 8 and 6 days, maybe have them there, and available. But the Pantages in LA is doing Hamilton right now, 2,700 people every night, and they're testing 1% of those 2,700 people. So that piece doesn't surprise me, but I think we got a Dylan date sometime in December. I wouldn't be surprised if Bob's crowd. And since Josh and Lisa's patrons are much nicer than mine, I'm going to send some of the comments. I'm going to send you some of the comments.
So you're going to share the comments with them, right? You're going to share the pain.
I'm going to have my IT guy cut. Lisa blushing when she gets them.
I think I can handle it.
Yeah, oh my goodness,
Yeah.
But my marketing director is like flipping on it, and your reaction is, especially younger staff, they want to answer, and I'm like, absolutely not. Don't do any of that. And we have an open refund policy. If you want your money back, we'll give it to you. No questions asked. And this is even once the show comes to town. I mean, that's very unique. And candidly, that's kind of where New York is right now, because, we want to stay in business. And so we're not putting up any restrictions. We're not requiring anything. But Lisa and Josh are right. People want to be back in those seats, and they're going to vote with their ticket.
Yeah.
I had a conversation with somebody in North Carolina the other night, and they were talking about capacity restrictions and all this nonsense. And I said, well, people are going to vote to come or not to come with their ticket. And if they can get a refund, why are you going to shut us down? You know, that makes no sense. You're just going to impact all my 250 event employees. And so, you know, we're cautiously optimistic, but it's going to be a lift. You know, it's as I keep telling my staff, it's going to be a very bumpy fall.
Yeah.
And we're going to have to be like Tom Brady. We're going to have to learn how to call an audible or two at the line, because it's not going to be all written down. Trust me. But it'll be fun. And we'll all have grayer hair, and I'll have fewer of them come like December or January.
We love Tom Brady. So, Lisa, what about how are you going to be doing for the pictures that are coming in? Are you going to be doing testing? What's the plan?
Sure. We have no plans for testing at this point, but masks will be required. And similar to what Josh reported they'll be doing, we'll be checking vaccination and negative COVID tests. People can show those on their phone. They can have the piece of paper. There's a great, I actually saw it on the Columbus Theater website. They provide a link right there where you just put in your name and your date of birth and your test date, and you can download, in case you've lost it or don't have it, you can download from the Rhode Island Department of Health, you know, a proof of vaccination. So that's great. And Josh, I'd love if you could share with the rest of us if you have any input from your research on any apps that allow people to do that more easily. And like you said, it sounds like there are apps that, so we don't see any private information, but there's a QR code. So would love to learn more about that. And again, you know, it puts, as Lynn says, you know, it's heavy lifting. You need more staff. You need extra staff at events to be able to check these things. And you need to train those staff. Some of our staff, I'll speak for us, are, you know, the people that are working at our concessions, selling movie tickets, that kind of thing, they're younger. So they have to be on some level empowered to be able to refuse someone who cannot provide that proof or will not wear a mask. And so I know that, you know, for retail establishments and restaurants, and I'm sure other performing arts venues, they've had to deal with that a little bit in terms of pushback when somebody, it's one thing to receive a nasty comment on social media, but how do you deal with a person who walks into your establishment and says, hell no, I'm not wearing a mask. Mm-hmm. And you've got a 17-year-old, you know, person who's standing there, and you know, this is an adult, and they're nervous about enforcing it. So I think those are the issues that will, and hopefully there will be very few of those. Yeah. But I think that those are things that are going to become difficult as time goes on, especially given the fact that, you know, we've joined this coalition, and Lynn, thank you for, you know, singling out Tom Parrish, you know, all of us, you know, grateful for him for taking leadership on getting this group together to put together this policy. But we're going to have to implement it. And what is that going to look like? You know, and how is that going to impact us moving forward? So hopefully continued smooth rollout, but it puts us in funny positions, especially when we all have these policies now. But then, you know, I just was in a coffee shop down the road, and you know, and in another retail establishment, and there's not even a sign on the door saying please wear masks if you're not vaccinated. Yeah. So there's big discrepancies. When we were in the middle of things, everyone wore a mask everywhere. People minimized going to stores and things. Everyone had the same policy, but I think what we're seeing now are different policies in different places, and people have the ability to move about freely, go into a coffee shop, go into a clothing store, et cetera, without thinking about their masks. And then suddenly they come in to see, you know, performing arts events, and it's, you know, there's a major policy about it and a lot of steps that they have to take. So I think that's going to be, it's confusing.
Yeah, I think the most we can continue to say that front, that this is your protocol, is going to help. Actually, I want to give a shout out to Trinity Repertory, because we got their magazine. I'm gonna, that's what I was pulling in here. Oh yeah. Because everybody has a mask, the vaccine card, so they're putting the message out there. So as the more we can tell people ahead of time that these are the protocols that you have, I think that's gonna avoid those moments, uncomfortable moments right at the door. So thank you so much. We're running out of time, but really quickly, I would like to know, what is the one thing that you're looking forward the most about reopening? Let's start with Lynn.
Oh, I'm just excited to be back in the event business. You know, I didn't sign up to be an epidemiologist. You know, I just like to be back in the event business. We did Beaver Brown at Southside last Friday.
And you don't play one on theater or TV.
I like that. Beaver Brown and Southside Johnny the other night and charged $25 for a ticket. We did 2,000 people. Of course, I think we charged $15 for a beer to get us eating. Everybody was very well behaved, and you know, it's like, oh, we're doing events again. Oh my gosh, you know, and yeah, I just like everybody else. You know, that's what I signed up for, and that's what we're into it for, and we're ready to lock and load. That's kind of where we are.
Thank you. Thanks. Lisa, what about you?
Well, I think two things. One is I love live performance and live music. So I'm excited that now that we're open and other venues are open, that I'll be able to see more of that and experience it myself. And just, you know, we're new. We were not yet open when the pandemic hit, and we had our official soft opening July 9th. So we haven't been open for very long. We've done pop-up events for years, et cetera, but haven't been fully open for that long at this point. So for me and for all of us who work here and the people that, you know, our board of directors and everybody who's been behind getting this place, the community, getting this place up and running and renovated, it's incredibly exciting to just have the community come into our building. There's so much enthusiasm from them. And so having that energy in this building that we've been walking around under construction for the past 2 years is really tremendous.
Great. Josh, you have the last word.
Yeah, I'm just looking forward to having the activity back. You know, with rehearsals paused, you know, it was basically a ghost town around here a few months ago, and it's great to just have people back in rehearsal, and every day there's something going on, and you know, there's like a, you know, ukulele band practicing in the corner, and it everything just feels more alive. It's great to get back to that. So.
Awesome. I'm looking forward to getting back to seeing live entertainment. And I want to thank the three of you for everything that you're doing to make that possible. Thank you so much. Lynn, were you going to add something?
Oh, no. Thank you, Governor. It's been fun, and it's good. I think it's been good therapy for all of us.
My pleasure. And I have to say to everyone at home, remember, I'm just going to borrow a line from Hamilton: don't throw away your shot. Make sure you get your vaccine. Last year, think about 2020 at the beginning of the pandemic, how we were so desperate, hoping that we could have a solution for this pandemic. The vaccine is the solution. It's part of the solution. You have to do your part. Make sure you get your vaccine. Make sure to wear your mask whenever you are around individuals that don't live with you in the same household, and especially when you're in crowded areas. So once again, I just want to thank all the directors that participated today. I want to thank also the Department of Health in the magic that is happening in theater and the live entertainment venue. Thank you all for joining. And with that, good afternoon, and see you at the next time. Take care.